Thank you for joining For Our Special Kids, where we openly and honestly discuss the magic and the mess of raising a child with special needs. We are thrilled to have you here and hope this time provides you with some wonder and wisdom. I'm your host, Jennifer Lansing. Let's get started. Welcome back to part 2 of my conversation with Dr. Jennifer Miner. Today, we talk more about applications with children and how Jen approaches her patients. She dives into cranial sacral and how there are quite a few similarities between Chinese medicine and cranio. And at the end of our conversation, we talk about the work she does with the Dolphins in the Bahamas. I haven't forgot we need to get that episode out because it was such a magical, incredible time for Teal and our whole entire family down there. So in the next couple of weeks, we'll get that episode out for you guys. I hope you enjoy and let me know what you think. That was an amazing overview, and we could just dive into that for a while because I just like listening to you. I'm like, oh, I like learning.
Oh, you're kind.
So let's go application. How would you approach a session with you?
So the way I approach, as you know from our times together working with Teal, I don't do a tremendous amount of actual acupuncture with kids. I reserve that mostly for emergency situations, say a kid with a high fever. We know kids are so prone to getting high fevers, especially at night, right? And that can quickly lead into seizures, and especially when they're really young, right? So that would be a moment where I would absolutely use acupuncture because it's fast and it's going to make change very quickly to reverse course, hopefully, with what's happening in their bodies to reduce what we would call, like, say, an excess heat.
Yeah, because some fever is good at killing.
Some fever is good.
Yeah, but extreme fever is not good.
Right.
Okay.
Right. Yeah. So you want to tamp it back down and
quickly
just get it to that regular level where their immune system is fighting off in a healthy way whatever's going on.
Right. Okay.
So for emergencies, I'll use acupuncture. I have a baby I saw actually last week. There's third session with this little one for severe eczema. I did use acupuncture with her because she's so uncomfortable, and it's they just referred to me basically as an emergency, and so the acupuncture in addition is helping.
Wow.
But for the most part, I use an integration of Cranio Sacral therapy and Tui Na. There is a complete system of Tui Na used specifically for children, which we just call pediatric Tui Na for lack of a better description.
Right.
And also the way you approach treating a little one with cranial is much the same. There's special techniques. There's ways you approach the treatment, even though the underlying principles are exactly the same as when we're working with adults.
So a child comes in with attention issues, focus issues. How would you approach that situation?
I actually have 2 patients, both diagnosed, we'll say, by their teachers with ADHD. And basically the parents were told that, if you don't put your kid on medication, we're going to have to do something else.
Mm-hmm.
We're going to have to figure something else out. Parents don't want to do that. The kids don't really want to do that.
Mm-hmm.
Neither of them is on medication. Both kids agreed to come in and get regular sessions. So, we'll focus with one of them. He's just about ready to go to college, right? Just about ready. This is his last year and there's a lot of pressure on him. He starts seeing a therapist. The therapist says, yes, you need medication. His parents are like, you know what, if you're open to it, can we please try acupuncture first? So they bring him in and I start working with him. And I mostly do, again, a combination of Tui Na, right? Chinese orthopedic or Chinese osteopathic body work, and craniosacral therapy. And over a series of, I'd say 5 months, there's marked improvement. He, without hardly any acupuncture at all, but working with his meridians, working to balance his craniosacral system, looking for changes that need to happen in his diet, start to see some improvement in focus and concentration. And there's a reduction in the frequency of his teachers and his therapist saying you need medication. But
so
we were
it's
getting
allowing him to focus more because he's flowing easier. I mean, that's a very generalized way of saying it, but it makes sense.
Absolutely. Yeah. Yeah.
Oh,
He's feeling
yeah.
better in his own body. The
Hmm.
depression is dissipating. And yes, he's then more able to focus
Right.
slowly. It's incremental, right? It takes time because, as one of my mentors would say, Rome wasn't built in a day, right? We don't come into these chronic illnesses or these labels and diagnoses quickly. They build over time. So it takes time. If we want to establish a new, more solid foundation, it takes time for that to
Hmm.
happen. We can't expect to turn on a dime from an ADHD type
Right.
situation to a rebalanced, fully positive situation.
Have you worked with autism?
Yes, quite a bit. And craniosacral therapy and Chinese medicine both are quite helpful in for kids with on the spectrum.
So there isn't like just one answer. What I'm hearing is because there's all nine of these approaches within Chinese medicine, it gives you kind of like this toolbox to say, all right, I'm going to specialize my treatment plan for this individual based on everything from birth month, birth year, I mean, energy, I mean, everything, parent relationships, past. I mean, I would imagine you're even, I mean, I don't want to go all woo woo, but I mean, past lives. I mean, all that stuff really does have a huge impact on what we're experiencing in this moment. And I mean, you could just do nutrition, right? You could just say, okay, let's just play with nutrition right now. Also, do you look at like Ayurvedic stuff?
That's its own system of medicine. And you're absolutely right. Yes, most acupuncturists, as they're called, can and do use at least the top three:
Mm-hmm.
herbs, acupuncture, and maybe Tui Na or some other form of body work, right?
Mm-hmm.
So there are differences in the way acupuncturists are trained, and we'll come back to that because that's a bigger topic. So if any of your parents listening want to find an acupuncturist, for example, they're going to want to look for how they're trained.
Yeah. So let's go there. Talk to me a little bit about the training because it's extensive.
It is extensive. And so for a doctor of Chinese medicine, you're looking at 6 to 7 years of education. And that includes, like for myself, I did apprenticeship for many years, mostly in the US and some in China, working in the hospitals a little bit over a period of time. And there are some who do extensive, like 2 and 3 year stints in China. Personally, for me, the classical approach to Chinese medicine is what resonates for me. So it's harder to get that in China, believe it or not. The best at this point, most of the best classical teachers remaining are in this country. And you can still find some old Chinese medicine practitioners who in China who do emphasize classical treatment. But in modern China, a lot of what's taught is now what they refer to as TCM, which is a much more modern approach, and it's much more focused in acupuncture or herbs or maybe body work.
Okay.
So what I would recommend is that when you're looking for somebody who does acupuncture, that you find somebody who actually does think about all of these aspects, or at least most of them, right? That they have some background in the body movement, right? Like Tai Chi or Qigong, or the combination of the two is even better, or Gong Fu. That they also do consider the seasonal transformations or changes that happen and how to approach treatment during those times, that they do body work in addition. And for kids, that they've actually spent some time training specifically an approach to treatment for children.
Yeah. It's like seeing a pediatrician. I mean,
Absolutely.
there's there's an adult doctor and there's a kid doctor. I mean, it does make sense. Okay. So, I mean, this is all phenomenal. I was kind of thinking back to when you came up and worked with Teal and you did put needles in her. She wasn't
I
bothered
did.
by them at all. And I would imagine you are listening to the child and what they are telling you, whether it's telepathic or it's intuitive. You're saying, okay, this child is all right if we go down this road. Is that kind of correct?
Absolutely. Yes. 100%. Both craniosacral therapy and Chinese medicine. So Chinese medicine is a complete system of medicine separate from Western medicine or biomedicine, allopathic medicine. It's got so many names, right? It is its own complete system. We've kind of unpacked some of what that system is. Fundamentally, it's about the individual, just like craniosacral therapy. We are listening to the body. We are using all the tools in our toolkit for this complete system of medicine to offer any person, kid or adult, body is indicating is going to help it the most, is what it needs and wants. And so, different than doing to a patient, we are supporting a client or a patient in their process of healing, in their process of restoring balance in whatever way is best for them. And so, like that, I remember that treatment with Teal, one of many, and it was so fun. She's amazing. Again, like, kids know what they need, and if we just listen, and sometimes listening is with our eyes and our hands, right, not our ears. They will show us exactly what they need. And when they have more chronic or long-standing issues that they're wanting to work on, and the parents are wanting to work on, then sometimes, again, needles can help facilitate that change more quickly.
Fascinating. I want you back up here in Tahoe now. I have an apartment downstairs.
In 5 hours.
Right. The apartment just got cleaned. Well, there are so many other conversations that I want to have. I mean, I do want to briefly talk about the Dolphins and craniosacral and how that all really merges. It's funny because I do believe that we can heal ourselves within reason. And I know that's weird, but before having a child with special needs and before meeting complex parenting situations with very medically complex children, before getting into this world, I would have said off the cuff, no problem. Of course you can heal yourself. And, some of these things you can't just overcome, like an in utero stroke. You can't just all of a sudden overcome that. Now you can get yourself in balance and you can function a lot better, but it might not be the, in quotes, what everyone sees as normal, right. Sure. Or there's all sorts of different things that you can approach this with, or how you can look at it. But I do believe giving people ideas and different things to research and dabble in. I think you've done a really amazing job at that, because all of these things are very easily accessible. Where do people find the information? Is there one place? And then we're going to talk about dolphins. But is there one place that somebody can go right now and say, okay, this is where I can find a credible doctor
of Chinese medicine?
Yeah.
Unfortunately, no.
You're supposed to
Not
have
the answer
that
I know you were looking for. It really is, it's kind of like, you said, oh yeah, there are pediatricians, right? There's doctors for kids and there's doctors for adults. Chinese medicine is sometimes like that in terms of there are people who focus in just treating kids, right? And there are people who focus in just treating veterans or just treating seniors, right? And so but the specialties. So remember, this is a holistic, complete system of medicine. So we're looking at the whole body, we're looking at lifestyle, we're looking at diet. So it is common, therefore, for people of different backgrounds, different needs to all come to one practitioner, right? So
yeah, because you see a variety of people.
My youngest right now is 2 months. My oldest right now is 86.
And that's the beauty of this.
And I see a wide range of people for a wide range of issues from, and you name it, from pain. Pain is what acupuncture or Chinese medicine is known most for adults, but all kinds of internal conditions, neurologic, like digestive issues, for example, heart issues, right? Some problems with the cardiovascular system, renal issues, kidney issues, neurological issues, Parkinson's, multiple sclerosis, right? You name it.
Well, and infertility. You've got infertility.
Absolutely.
I had acupuncture before all my IVF treatments, and literally when they put Teal in, boom. They just tapered me from one little room to another. And then I got my soothing music and my acupuncture to encourage that little Teal to embed. There's so many different things.
Yes, absolutely. And the thing is, for people who practitioners, doctors of Chinese medicine, who are more experienced over time, right? They're going to treat a much broader range of conditions. I have people come to me for fertility. I'm not a quote fertility expert. I don't treat just fertility, or just for infertility. But I use the same principles of Chinese medicine and listening to the individual's body to tell me what they need. And I work with that, both from Chinese medicine and craniosacral therapy perspective, right? There's not really one place where we're all listed, right?
Right. So
That's
could you do a
the hard
Google
part.
search? I mean, could you do a doctor of Chinese medicine in my area?
You can. That's probably the best place to start.
Mm-hmm.
Well, the best place is always to ask friends.
Right.
Because if one person has found a good Chinese medicine doctor, then they're going to want to share, so long as they can still get in for their sessions, right? Or their kids' sessions.
Right.
Google, if you don't know anybody who already has a great doctor of Chinese medicine, then yes, Google is a good place to start, but then you'd want to interview them.
Yes, of course.
And that's what I always recommend. Friends and family, like, hey, if I don't know somebody in your area, I'll look up a few people and then say, talk to this person or that person and ask them some basic questions, including their education level. There are still people who are licensed acupuncturists who aren't doctors of Chinese medicine. There's a distinction in that. We're seeing that happen live in this country. They're all doctors in China. They've been recognized as equal to an MD for many years. In this country, that's just now happening over the last 5 to 10 years. But I know a lot of acupuncturists who've been in practice for 30 or 40 years who don't have a doctoral degree, who I would go to in a heartbeat over somebody with a doctorate. Just because they have a doctorate doesn't mean they know more necessarily. Clinical experience counts for a tremendous amount.
Right.
So I wouldn't just look at that, but I would look at their education, look at how they practice. Do they only do acupuncture, or do they also use herbs? Do they also do movement therapies? Do they also help with
nutrition
lifestyle,
or
lifestyle.
nutrition? Yeah. One thing that you mentioned or we talked about is the following the child or following the adult. And when Teal was down in the Bahamas this last in August, she basically led the whole like all the sessions. It was hilarious and somewhat disturbing at the same time, because she just knew where we were supposed to put, where the therapists were supposed to put their hands, and she would take a hand of a therapist and put it on Alex in a certain spot or on me in a certain spot. And of course the practitioner would be like, oh yeah, that makes sense. And so let's chat about the cranial sacral system just briefly, because I just want to do a little carrot, and then I think we'll just bring you back on and talk specifically about the cranial sacral dolphin assisted therapies, because that'll lead us right into me taking snippets from our experience down there. So give me a little carrot.
Yeah. Okay. So the cranial sacral system we're working with brain, spinal cord, the cerebral spinal fluid, or CSF, that flows through the brain and spinal cord to keep it bathed in nutrients and to take away metabolic waste, to clear that from the system, as well as our cranial nerves. And the nerves can come off our spine to innervate our peripheral nervous system, right, to innervate our bodies. And so, but we don't just put our hands, so cranial and sacral, right, head and tail, right, or head and tailbone. We don't just put our hands on those two places. We use gentle touch to go to specific areas of the body where there might be injury, or we talked about like places where there might be energy that's stuck, just like with Chinese medicine.
Very similar.
Stagnation,
exactly. Yes.
Right? And that can be from physical injury, a lack of rhythm, a lack of flow. That can be from physical injury, emotional injury, life, birth, literally from birth sometimes. And we put our hands in those places very gently. We follow the tissues, and they will move. We just follow it. We stay with it and allow for release to happen in whatever way is right for that person, whether they're small or grown, full grown. And so, you said Teal is putting her hands, sometimes having the therapist's hands on you or Alex. That's a beautiful, perfect example of cranial and also of Chinese medicine. We're not just working with the person, we're working with the person's connections and environment and surroundings. The three of you make up a family a beautiful family.
Yeah.
And there has to be flow and balance for health for all three of you. There has to be good flow and balance, right? And it's dynamic. We talk about balance as though it's just this set thing, right? I've achieved balance. No,
For
right?
a hot
Yeah.
second.
For a hot second, right? And so there is a dynamic nature to it, but what we want is for it to be as smooth and that great foundation so we can restore balance as easily as possible. We get a cold, we're down for a few days, and then our body quickly comes back because we have a good foundation of health.
Right. And how do the dolphins work with that foundation of health and flow?
Well, here's the thing.
And they don't really work. And they don't really work. They're, I know that's a tricky word because the dolphins are interacting with us.
Absolutely. Perfect word, interacting. And we don't really know what they do. And, you're going to say, what? Why would I go there? I mean, you won't because you've been there and you know. They do things. It's just like with us putting our hands on a patient or a client for craniosacral therapy or with Chinese medicine. We connect in and we allow for change to happen as it's right for that person. We do the same thing with the dolphins. We let them come in. They're free to come and go, as you know. And they come into these sessions when we're floating people in the water and we let them do what they do. We don't there's not trained behaviors. We don't ask them to do certain things. And it's amazing what can transpire in those sessions, right? I mean, you've seen it firsthand. You've felt it.
Yeah. It's mystical and magical.
We know they use sonar, right? Mm-hmm. We know they use frequency or vibration. They use sound and they use touch. So in some ways, it's not really very different from cranial or from acupuncture or Chinese medicine, right? And this brings me back to the young man I was speaking of, the teenager who we talked about with ADHD. So he had come really far, but he still was feeling like he was going to have to go on medication. And I was going to be in the Bahamas, and I recommended that he come for one of the therapy programs. And his parents were like, "We're putting him on a plane tomorrow."
Wow.
When I had already left, gone to the Bahamas, and they reached out and said, "Look, we really feel like we're up against the wall here. The therapist is really going to push for this, even though he's improved so much." And I said, "Look, I would recommend this." And they literally put him on. They bought a ticket and he was on a plane like 2 or 3 days later.
Wow.
And he came for the session. It was some of the most beautiful treatments I've seen. There's been some amazing things I've gotten to witness. I've been fortunate enough to witness. But the interaction between him and one of the dolphins in particular, Sandy, one of the younger dolphins, she literally brought him 2 presents, not at the same time. And those presents, one was a leaf that she pushed over and put in his hand during a session. Wow. It was amazing. And then she brought him a reed in another session, another day. Those are significant. You might think, like, if for anybody who hasn't been there, you might think like, oh, big deal. But it was for him, the depression and the ADHD type symptoms were really connected to wanting to be more connected, to feel love and support from his family and toward his family and his friends. And he had been missing that. And so this dolphin, without any training, without any signals, was making obvious gestures of connection.
Right. And love.
And love.
The
it was
energy,
incredible.
Yeah. It's so interesting as I'm thinking about people who have never experienced it, listening like, yeah, okay, pushed a leaf into your hand. But the effort that it takes a dolphin to do that, to like get it to work and go where you want. I mean, and then what you said, there's no way you can be in that water with those magnificent animals and not feel extreme joy and love and connectedness. It's just, it bubbles in the water around you. It just infiltrates. It's like it just gets in you, and everyone is transformed. Even if you're just out watching, you're transformed.
That's right.
And that's, I think, what you're really saying in all of this, whether it's acupuncture or Chinese medicine in general, or the dolphins or cranial sacral, it's us finding space within ourselves that feels connected to ourself and loving of ourself and joyful within ourself and having that harmony.
Absolutely. It brings us back to us.
Yeah.
Yeah. Without it, it just pulls away or breaks off those facades and those protections and the injuries over months or years, a lifetime that might be physical, might be emotional, might be something else, who knows, that we build up, right? And or that develop in our bodies that change how we are every day.
Mhm.
It allows us to change. You see somebody who's depressed and they're hunched over and they're, walking in a way that's, you can tell there's something not good, not
Yeah.
right for them. They
Yeah.
don't feel good. And then you see somebody who's happy and open. We literally say that, oh, you look really open, right? You're standing upright, your chest is open, you're breathing, there's a glow to your skin that changes. It changes us completely in our structure, as well as our heart, our physical heart, as well as our emotional heart, if
Yeah.
you will. Yeah.
Thank you for chatting with us. We're going to bring you back and talk about all sorts of things. I think food is medicine is a
Oh.
huge one. The scoop on poop.
That's right. We should do that.
We need to talk about the scoop on poop. So
Scoop on.
everyone who's listening, just keep looking out for Jennifer Miner. How can people find you, Jen?
You can check me out on my website, www.sixharmonies.org. And I hope to be doing some online things really soon. So, if you're interested and you have things you want to talk about, just shoot us an email, info@sixharmonies.org, or connect with Jen and she'll let me know.
I will totally get you in touch. Thank you very much for spending some time with me and educating me on all of this. Whew.
Thank you so much for the invitation.
Yeah, I look forward to bringing you back. Thank you. After we concluded this conversation, Jen texted me and realized that she hadn't given me the punchline for the teenager who was heading off to college, whose therapists and teachers wanted him to get on medication, and whose parents sent him to the Bahamas for dolphin-assisted cranial sacral therapy. So this was the boy who was very depressed and received 2 gifts from the dolphin named Sandy. Well, that young man did not have to go on medication to help with his ADHD, and he is doing well in college. That is good news. Hey, if you can take a moment to rate and review the podcast, I would really appreciate it. It helps other parents and caregivers and people like you to find us, and the more people we can touch, the better. So I hope you're having a great day, and thanks again for listening. Thank you so much for joining us today. I hope you found 1 or 2 meaningful nuggets of information to make your day better. If you think there's value in what we do, please take a moment to tell another friend, family member, or a caregiver. We'd love to hear from you at forourspecialkids@gmail.com. You can send in a question, a comment, a topic that you'd like to learn more about, or if you'd like us to highlight a certain person, please send that information to us. It makes our show so much better and so much more valuable for you. Our Facebook and Instagram handle is For Our Special Kids. And finally, remember to witness the wonder and the wisdom within yourself and others. Until next time.